Good afternoon. I'm Kerry Smith. I'd like to begin by acknowledging the Coast and Strait Salish people and their elders past and present, upon whose territory we gather today. I'd like to thank also my practicum supervisor, Dr. Ian Butterworth, who cannot be here today, for his support and guidance. I'd also like to thank Catherine Worthington, Victoria Barr, Betty Taylor, and Scott Naismith for helping guide my practicum learning journey that brings me here today. I had the opportunity to undertake my practicum placement through the State Government of Victoria in Melbourne, Australia. The department is responsible for a wide range of health and human services programs, all the way from family services and child protection through healthcare, all the way up through upstream public health initiatives. It was a really interesting time. As a part of my practicum, I worked on the project to develop a communications framework for a small place-based, well, it's actually quite a large place-based project that they're working on in the Frankston train precinct as part of their redevelopment. Melbourne is a vibrant city of 4.5 million people, and it's been ranked as the world's most livable city for the last 5 years, according to The Economist. Livability, though, means many things, and as you'll see in the next slide, this is Frankston. This is Frankston Beach, and it's hard to argue livability when you see a beach like that and it's right in the city. However, livability is a concept that both acknowledges and the social determinants of health, and it defines measurable domains around them. The University of Melbourne and the State Government of Victoria, through their various departments, have embraced livability as a term that can measure outcomes for health and in terms of livability and access for a wide range of the community. Livability domains include housing, transportation, social infrastructure, food, employment, public open space, and walkability. So scratching the surface reveals that Frankston here is not livable for all of its residents. And actually the train station precinct is just beyond that red building you can see in the far distance there. So Frankston is located, Melbourne is at the top there, that's the central business district, and Frankston is the large purple area down there. It's 40 kilometres from the central business district, and it's commutable by train, and people do. It's about the furthest distance people do commute by train easily, the train precinct is where all the action is and where my project was centred. It also is a region that feeds down into the Mornington Peninsula down here, which is a gorgeous bayside area where people have a lot of holiday homes, and it's a lovely place to congregate. The population is roughly 130,000 in the Frankston proper, where it's purple. It's a local government area as well as a suburb. And the Mornington Peninsula covers about a population of roughly the same, about 120,000 people. So if we zoom in to the same map, you can see, this is Frankston. You can see the suburb of Frankston there in the main red dot there. And the wide diversity of socioeconomic backgrounds that utilize the train precinct are hugely diverse. The area in the red spot includes some of the lowest 10% of the SES, the socioeconomic status, in the whole state of Victoria, while in the blue represents the highest 10% of SES in the state of Victoria. So you can see that they're sort of sandwiched together, and because Frankston is a feeder for the train commuters and so forth, and it's a central business district, that it's a place of major confluence. That it feeds all different backgrounds through it and different circumstances. So it's a highly contested political area. And the last recent government won due to their commitment to do something around the Frankston train precinct that has been an issue since the 1970s. Within the precinct, it has the highest rate of alcohol-related hospital admissions in Victoria, the highest rate of pharmaceutical-related admissions of any metropolitan region, the third highest rate of admissions for illicit substance abuse, and the perceptions of economic and the commercial impact of these social circumstances are felt throughout the community. There's also concerns related to safety and crime throughout the precinct, which affect livability. So why a communications framework? The state government of Victoria has committed $63 million to redeveloping the station, the physical train station, where they perceive and where the issues are congregated. And as a part of that, the state government Department of Health and Human Services sees this as an opportune moment to address some of these deeper issues around alcohol and drug abuse in the area, and that consequently affect crime. The department has multiple roles in the area as leader, advisor, funder, and stakeholder within the precinct. And so a communications framework was, there was a need within their initiative to pull together the stakeholders in the area and to have a clear message for communicating that the initiatives that are being undertaken by DHHS, and to enlist and collaborate with stakeholders. When I met with the group, they came up with 26 stakeholders that they're currently engaging with, and the myriad of messages around what's going on in Frankston and what they need to do and where they're going were so complex that they found that if they had some sort of framework, as they described it, it might help them clarify their goals and enlist support. So they were after consistency, stakeholder awareness, support and participation, and to influence the upstream policy response. So upstream initiatives, although similar to Canada, they're still in their infancy. It's not regarded policy and practice that we need to work at it to make it work, to put it into practice. So the communication plan objectives. There are 7 key objectives, and it's to have straightforward messaging and the commitment to demonstrate commitment to stakeholders that the Department of Human and Health Services is committed to working on the initiative throughout the precinct, to maintain focus, to collaborate with service partner support, improve livability and encourage business owners and workers to live and work throughout the region, and solicit support from various service delivery partners. So to narrow down the 26 stakeholder groups, they were clustered into groups of decision makers and funders, service delivery partners, and groups impacted by change. So overall, I was able to cluster them into 8 stakeholder groups, and there were subgroups and key influences within the groups. And some of the key messages and delivery approaches overlap, and they might be similar, but many are different depending on the target audience. This is an example of the overall framework for each stakeholder group. They're listed there in the 3 clusters: the decision makers, the service providers, and groups impacted. And these are the 8 stakeholder groups and their messages. While the messages are less important for today's discussion, it was of key importance to the department that the messages were clear for each stakeholder group, and that any staff member representing the department at a meeting could pick up their framework and take it to a meeting with them and communicate what it was to that particular stakeholder group that they needed to message. So this is an example of the stakeholder for the local members of Parliament, the framework. And they all look like this. They're a one-pager, they're concise. They have an aim, the overall aim for the the message for that group. There's a primary message and a secondary message. When I did my literature review, it indicated that 2 key messages were the main things that you wanted to focus on. And in each in each stakeholder communication. And so that's what I put through each framework. And there's a message delivery mechanism for each, a reason to believe in a rationale, and likely obstacles, so that the department can look at that and have some perspective when they step into a meeting and say, okay, well, I can expect to come up against this because of funding limitations and so forth. Thank you very much.
Thank you. Questions? That's all right. I like exercise.
Hey, Kerry. So one of the interesting things about your project was that you were, as you said, creating messages for a wide variety of stakeholders. And, we take a social justice lens on this. Mm-hmm. Were you trying to do any education of particular stakeholder groups while you were doing the messaging? And how did that play out in the way that the goals were framed for the messages?
Yeah. Well, depending on the stakeholder group, there were certain parts of different groups that some were responsible for some educational component, whether it was the department wanting to educate them on what the department was doing, or whether it was enlisting them in some sort of program or pursuit of, sharing the intent, and also informing that there was greater stakeholder groups also involved. A lot of people weren't aware that there were other stakeholder groups already working on a similar task within the same precinct. So it was a true public health initiative in that sense, in that it united many of the programs that are currently taking place within the precinct. Did that answer your question?
I have one sort of more general question about Melbourne. And within Australia, is there a large sort of movement of people from other areas of Australia to Melbourne, or is it? There is some. There's quite a bit of immigration, both from outside of Australia and within, and to the cities. The cities are getting more dense. Melbourne, 4.5 million, and it's growing. And indeed, it's moving down and around the Bay. The Bay is a prime spot to live, obviously, from the beach. And so, yeah, there's issues with immigration and languages. Less so to some degree in Frankston. Dandenong, another area, they've got a huge refugee component. It comes to livability and affordability, and Frankston tends to be less affordable, but there are these pockets, and a lot of the precinct issues is around this particular pocket. And could you speak very briefly to sort of the ethnic sort of composition?
Yeah, well, from Dandenong actually, and I was based in Dandenong for the southern region. There's a lot of African immigrants, and so there's a big influx. There's Syrian refugees, of course, coming, but they're in Perth so far, and they haven't sort of moved across to bringing them to Melbourne. And then a similar mix to here. There's more sort of Iranian and. Well, actually, mostly the African population is the most recent large influx. Yeah.
Good. Well, thank you very much.
You're welcome. Thank you.